We are back with certified nurse midwife Fran Cresenzo-Dishmon talking about how to have a healthy pregnancy. So once someone thinks that they might be pregnant, what are the first steps that they should take? Like, how soon does prenatal care need to begin?
So, if you think you're pregnant, the first step is to confirm your pregnancy with an at home test. And if you're like me, and actually most women that I know, once you get that first positive test, you're going to take about five more before you finally believe it. So, that you can certainly confirm it with an at home test. So, once that's been done, you need to contact your provider to make your first prenatal appointment. And these appointments often don't start until 8 to 10 weeks, particularly if you did your preconception visit. But I would say that if you did not have the chance to do that and you have medical conditions that you feel like you need to discuss or medications that you're not quite sure about, let the scheduler know that you have these concerns so they can get you scheduled accordingly. Um, if you should also, once you know you're pregnant, you should go ahead and start a prenatal vitamin if you have not already done so. And I would stress that don't stop medications without talking to your provider first. I can't tell you how many times I see a patient that says, "Oh, well, I didn't know if I could take this medicine while I was pregnant." And then they've been suffering for a couple of months because they really needed the medication. So just don't stop medications on your own.
Okay, let's talk about medications and vaccines. What should women review with their provider before or early on in pregnancy?
Well, obviously the prescription medications, but also include and let your provider know what over the counter medications you're taking, any herbals you might be taking, or supplements. Some are going to be safe, some are not going to be safe, some might just need adjusting, and some just need to be avoided altogether. And then vaccines that you need to discuss ahead of time, preferably would be your MMR and your varicella. Those can cause some really funky birth defects, and you can't get those. Well, excuse me, the diseases themselves can cause really funky birth defects and problems, and you don't get those vaccinations while you're pregnant. Now, while you are pregnant, we are going to recommend some vaccinations such as the flu shot, COVID shot, and Tdap.
Okay. All right. So what happens if you get pregnant and you don't already have an OBGYN? How can they find care and get that appointment quickly?
Cone Health has made it super easy. You go to conehealth.com/prenatal, and it has all of our, I believe it's eight Center for Women's Healthcare offices, which are all across the triad. Um, we have traditional prenatal care, but we also offer some really kind of cool variations on that. We have something that we refer to as centering, which is basically group prenatal care that's become real fun and popular. We also have something we call mom baby combined care, where our fantastic family medicine OB doctors not only provide prenatal care to you, but they pick up your baby as a patient after it's born for a couple of years. So that's
Oh,
pretty cool. And then my favorite thing to talk about is our brand new mobile health OBGYN unit. So we have the ability to now bring prenatal care out into the community. So we are working to remove barriers such as transportation.
what does good prenatal care look like? I mean, if you've never had to go to the doctor, right, for, having a baby, you don't know what good care is versus like, oh, I should have had that and I didn't know it.
So quality prenatal care is not only about checking on the mom and the baby. We care for you as a whole person and as a unit. And so when you are getting your prenatal care, we hope that you can build a relationship with your provider so that you can create a safe space for you and develop trust between you and your provider. We want you to always feel informed and heard and empowered when you leave your prenatal visits.
All right, we've got about a minute left or so. What's one thing that you'd like to leave us with, or maybe something we haven't talked about that should be top of mind that maybe women who are newly pregnant don't have that on the top of their minds?
One thing that I see all the time that women do not prioritize is their mental health. So, anxiety, depression, chronic stress, poor sleep quality, all of that really matters during pregnancy. And so, emotional health is very, very important as it contributes to your physical health. And before you get pregnant is a really good time to work on that. Dental health is also important. So, we encourage you to take care of your dental health as well. But I guess I would say the healthiest pregnancies often start before a positive pregnancy test. And so any steps that you can take now really can matter.
All right, thank you so much for your time and your expertise. If you'd like to watch this again, maybe you need to send it to someone who's thinking about getting pregnant. You can look on our website. It will be in the To Your Well-Being section of our website.